Mine ain't doing that
Is it lit up on the bottom? Yeah, yours should be.
either. Testing, testing. You working one time.
Yeah, yours was working earlier. We can share.
There it goes. $30. Wow, I can hear myself echoing. Turn your mics on, please, so she can check them.
Test, test. Mine's working.
Yeah.
Mine's working.
All right, it's 6 o'clock. I'll call to order this meeting of the Scotland County Board of Commissioners, June 2nd, 2025 meeting. And we'll start with an invocation, Commissioner Shelley.
Let's pray. Father God, we come to you this evening giving you all the praise and glory, Lord. We come here humbly as we possibly can, Lord. We ask that you give us wisdom in our directions throughout for the betterment of this county. Continue to bless each and every one of us as we try to do your will to better your kingdom. In Jesus' name, amen.
All right, let's stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Dorothy, did we turn the sound on the YouTube?
It's already on.
It is on.
Be on.
All right, next item is the approval of the agenda. Need a move. We have a motion to approve the agenda. We have a second.
Second.
We have a motion and a second. Any other discussion? All in favor, say aye.
Aye.
Any opposed? Next is our public forum. Dorothy, you said we didn't have anyone signed up for that
No one
in
signed up for
advance.
public.
Does anybody want to speak in the 3-minute public forum? All right, seeing none, we'll move on from that, move on to our consent agenda. If you've had time to review that, we'll need a motion on the consent agenda.
So moved.
Okay, we have a motion. Do we have a second? Commissioner Williams, second. Any other discussion? All in favor, say aye.
Aye.
Any opposed? Thank you. All right, Cecilia, I saw you. There you are. Trillium Health Annual Update. Is that one on, Dorothy?
Yes, sir.
Okay.
Good evening. So before the annual update where I maybe bore you with some data, we wanted to share a big check. So I will turn it over to Haley Sink, who's our director for, tell me your title again, because it changed.
Community Health and Innovation.
Community Health and Innovation. And we wanted to share with you the opportunity and our excitement for partnership to help build an inclusive playground here in Scotland County.
Okay.
Thank you so much, Cecilia. Good evening, everyone. Thrilled to be here with you in Scotland County this evening. Thank you all so much. And we are very, very excited. It has been tremendous working with April and just really getting together project here in Scotland County to bring an accessible and inclusive playground to the community, or the second one, I believe now. So we are very excited. This is part of 6 different projects that we're funding this year across Trillium's 46 counties. And I know you'll hear certainly more from Cecilia on the health plan side, but for every dollar we save, we reinvest right into our communities. And the Let's Play Together Playground Grant has brought over 43 playgrounds across our 46 counties in the past 10 years. And when we started this project, there were exactly 0 accessible playgrounds across our communities. So we are incredibly proud of this. It allows not only children that might be using a wheelchair, have different abilities to play together, but also thinking about parents, grandparents, wounded warriors that have children, and just bringing everyone in that community together to have the opportunity. So thank you all so very much for your support of this project, and we are thrilled to present you $250,000 towards that playground.
Hold on, we're gonna get that fixed. Go ahead.
No, you were just fine. And stay tuned, the community, we will do a big ribbon cutting once the playground is finished, so probably early 2026, and everyone will be invited, and we can't wait for that. So thank you all so much.
Do you want to do a picture with that, with all of us? All right, let's go up here and we'll.
I was like, someone take the
One more. Thank you.
Yeah, I served on that board.
You do.
Yeah, I served on that board. I've been down the board on conference.
What number is it? Okay. Thank you, ma'am. There she is. Thank you.
Thank you.
All right, go right ahead.
Okay. I think we're going to pull up some slides. So just to circle back, my name is Cecilia Piers. I am the Southern Regional Vice President with Trillium Health Resources. We are your tailored plan and your local management entity, managed care organization. So we serve Scotland County and 45 other counties in the eastern and central part of the state. We cover Medicaid services, in particular, services for people with the most significant mental health, substance use, intellectual and developmental disabilities, and traumatic brain injury. For a certain part of the population, we cover physical health services along with those behavioral health services. And then we also cover services through a state plan for people who have no insurance or are underinsured and have significant mental health needs. So just wanted to share a little bit. This is a little bit different than the presentation that I sent over.
This is what we,
Okay.
is there a particular page you want me to go to?
I think this is the old presentation, the one I provided an update for. I mean, I can talk through some things, but my,
That's the one that we had. We're not gonna have be able to pull the other one up. So
Gotcha,
Are
okay.
there certain pages on this you'd like me to go to?
this is a different presentation than the one that I had shared over earlier. I can kind of talk through some of the information,
Okay, let's do that.
if that would work.
That's fine.
Let me make sure that I have all my data points. Okay. So just wanted to share a little bit about our mission. Our mission is transforming lives and building community well-being through partnerships and proven solutions. And really, I like to focus on the partnership piece of that because we are a local plan. We have local governance. We have staff in the communities working with your residents, with our members in the community and partnering with organizations to deliver services. And so those partnerships with our members, with you all as elected officials, with our providers in the community are really key to what make our service delivery work here. So after consolidating, we are one of 4 tailored plans. There actually is a map. If we could pull up the map, that would be great. So the map on the right side of this slide shows Trillium in green, and the total population in our service area is 3.1 million. And that's compared, if you want to look at the area in pink, which is Alliance, the total population in that area is 3.5 million. So if you think about how service delivery has to look very different in our catchment area with mostly rural counties, very spread out in terms of land mass, we have to work with our providers differently and look at how we deliver services differently in order to reach our members who are the most vulnerable in terms of their high needs and high utilization of crisis services. So just wanted to talk a little bit about, when I talk about us as a local management entity, we really are focused on those local relationships and trying to work with every county. We believe every county has a voice, every county has similar needs, just in different volumes. And so what we have done with our catchment area is broken it up into 5 regions. So Scotland County is one of 9 counties in our southern region. In the region, we have a regional advisory board. So Commissioner Williams serves on our regional board, and we really appreciate his partnership and service there. And Carol McCall, former commissioner, also serves on the board. And so we work really closely with those stakeholders and others to try to understand the needs of the community and also be involved in community meetings and activities to make sure that we're sharing out what's available and that we're hearing what the needs are. Myself, as well as Terrell Alston, who is our Associate Vice President of Regional Operations, and Crystal Morrison, who's our Community Liaison, we all work in the county to participate in meetings and activities and events here. In addition to the regional board, we also have a Consumer and Family Advisory Committee, and that committee is made up of members and their caregivers to provide us input directly and guide operations from the member perspective. So it's people who are receiving services through our systems that provide us input on how that service delivery is going, whether they're satisfied with providers, whether their providers are meeting their needs, whether other services are needed or in different volumes. So we really value that input and that local feedback. We also have a governing board, and we have 4 members from our southern region representing the southern region on that governing board. So we have our regional board representative is from Lee County, our CFAC members from Robeson County. We have a member of the Lumbee tribe, who is part of our governing board, and we have the chair of our Health Disparities Committee is from New Hanover County, and he participates on the governing board as well. So we have good representation from the region, bringing information back from our regional boards and other committees within Trillium up to the governing board to provide input and guidance on the operations of the organization. So I know we don't have the charts pulled up, but just wanted to share for fiscal year of '24, our revenue was a little over $1.2 billion. We expect that essentially to double for fiscal year '25 because of the launch of our tailored plan. The addition of that physical healthcare component, including the pharmacy costs for our members, are really what is driving that revenue increase. The majority of that revenue goes right back into paying providers directly for care through Medicaid. We meet the state's risk reserve requirement, which there's a small percentage, I think it's about 3% of a risk reserve. We also receive revenue that goes into covering the cost of those state-funded benefits for people who have little or no insurance and need behavioral health care. And then we receive some administrative dollars. It's about 11% of our budget, and that is really to provide oversight of our contracts. We have 2 contracts with the Department of Health and Human Services. So there's, let me, if you don't mind, I'd like to pull up just a few pieces of data to share with you all. In terms of the number of members we're serving throughout the catchment area and since tailored plan launch. And I apologize for the delay. I just want to be able to share some more numbers with you. So while I try to pull that up, when I presented this last time, we had just launched the tailored plan, which is that whole person benefits plan that we are contracted with DHHS to offer to our members, providing both physical and behavioral health services, the non-emergency Medicaid transportation, care management service, and long-term services and supports. That is part of a process of Medicaid transformation that the state has gone through over the last 10 years or so. The last piece of that process is the launch of the foster care plan, which is called the Child and Family Specialty Plan. That is scheduled to launch at the end of this year, on December 1st. What the state did was they contracted with Blue Cross and Blue Shield to provide one statewide plan for all the children who are in the foster care system. And eventually it will cover children who have aged out of foster care but are still participating with DSS for some additional support from the ages of 18 to 21, and then also families of children who are in the foster care system. That plan will cover both the basic and enhanced services that standard plans and tailored plans are offering. So we'll see what happens at the launch of that service, but that is essentially the next step in that Medicaid transformation process. So since the launch of our tailored plan in July of 2024, Trillium has served around 80,000 unique individuals. About 63% of that population experience mental health needs. Around 17% experience substance use needs, and around 20% were individuals with intellectual and developmental disabilities. And in that 6 months, we had a total value of service claims of around $800 million. Again, our claims always have about potentially a 3-month lag or so because of the time that providers have to turn those in. So we expect that claims and revenue are estimated at around $3 to $4 billion with the launch of the tailored plan. Throughout our 46 counties, Trillium serves around 28% of the Medicaid population with standard plans, those plans who are serving people with Medicaid and have mild to moderate behavioral health needs, serving around 72% of the Medicaid population. And that is true here in Scotland County. So your county has a little over 17,000 individuals who receive Medicaid, and Trillium serves 8% of those individuals with our tailored plan, with that whole person care. Around 20% are still in the Medicaid direct system, so they are people who we're just providing behavioral health services for because they're Primary care and physical health services are covered through another insurance, and they're carved out of managed care. And then Carolina Complete Health, Healthy Blue, and United Healthcare are your three largest standard plan providers. So for individuals who have mild to moderate needs, they have a choice of participating in one of those standard plans, and those three plans are serving around 16 to 17% each of members in Scotland County. So I'm going to wrap up and just share a couple of updates and some local data. During the last year, we have expanded our Child First service. So one of the things we like to do is get ahead of the needs of our members and try to intervene before mental health, substance use, developmental disabilities become increasingly severe. And so we've launched Child First, which is a service provided to the 0 to 5 population. When a child is diagnosed with some sort of disability, it helps parents navigate the service system. It helps them understand and manage behaviors at home. And the goal is really to keep families intact, to keep kids prepared and engaged for school, and avoiding out-of-home placement and juvenile justice involvement later on when behaviors can become unmanageable without intervention. We also launched, in partnership with the Department of Health and Human Services, an app called Chess Health. That app is for people in recovery, and it's another tool, just like you would use any other app, to help track recovery plans, have people be able to access meeting information, peer support, services and skills that help them maintain their recovery efforts. And then we continue to partner with local agencies for training, like crisis intervention team training with law enforcement and other first responders, mental health first aid training, suicide prevention training, and those are available to community groups as well as law enforcement and other county departments. So if anyone's interested in training, we'd be happy to set that up. And then just to review the members served in Scotland County, just in that 6 months between July 1st and December 1st of 24, when we launched Tailored Plan, we served around 1,200 members in Scotland County. 875 received services for mental health, 296 received services for substance use, and 212 received services for intellectual and developmental disabilities. And the value of those services was a little over $11.5 million. So just a reminder, if folks are looking for support from Trillium or want to get more information about getting care, our access to care line is 877-685-2415. We also have a behavioral health service line, and that number is 888-302-0738. That is staffed with clinicians 24/7, 365. So if someone's experiencing a behavioral health crisis, we can take those calls regardless of insurance. We'll connect them to crisis services and other supports in the community. So I apologize for technical difficulties, but I'm happy to take any questions.
You can send that, y'all get together, and then she'll send it
Yeah,
out to everybody
absolutely.
afterwards, so. Okay, anybody got any question, anything?
Yes, just one. I've heard that there's you mentioned training law enforcement and all that. I understand there's also a mobile crisis team.
Yes.
Can you speak to how that is and what they've done in Scotland County?
So I don't have any data with me on that. I'd be happy to follow up and gather some data from them. I've actually asked them for that as part of our community crisis plan. The mobile crisis team is staffed by Monarch Health Services, and they will respond within a 2-hour window to any behavioral health crisis, whether it's mental health, substance use, or developmental disabilities. And the goal really is to connect that person to care. If the person's crisis can be de-escalated before utilizing law enforcement or the emergency department, they will try to do that. Otherwise, they will try to connect that person to those services depending on the acuity of the crisis.
So are they also capable of being IVC assessors or?
So they would work with the person to understand what their concerns are, and they potentially could initiate the IVC process, but they would bring them to the hospital.
Okay.
The-
Are you asking whether they would transport? Would they
No,
do monitor-
I'm not. I'm asking if they can do the IVC assessment to determine whether or not, you know, any further evaluation or whatever the right intervention might be.
So there is not always a clinician that is dispatched. The staff may be a qualified professional, a mental health professional that is under the supervision of a clinician, so they would not necessarily always be able to do that assessment process. There's also a health component to that assessment
Yeah.
that they are not able to do. So I think we've had some discussion about other options.
Yeah, I'd be really interested in the response we're getting from Monarch and how those services are made available in Scotland County. Because the IVC is a significant challenge, and I'm not sure we have a great process for it as it stands, so.
And just so you're aware, that is definitely a concern. And so we have also contracted with an additional mobile crisis provider to provide some backup and potentially reduce the response time. That's Southeastern Integrated Care. So they're in the process of staffing up to be able to provide that team here. And so I'm happy to keep you all informed when they get closer to being able to fully operate.
Chairman Ivey, I think it'd be good to get someone here to talk about that. This touches a lot of different things in our county and people, and I think it'd be good for us to hear from them directly.
Okay. You can make that happen.
I'm happy to make that happen.
A Monarch and this mobile services, the additional add-on potentially.
Okay, great. You can coordinate
you.
that. All right, thank you, ma'am.
Thank you.
Appreciate it. All right, moving on to our next item is Elder Abuse Awareness Month proclamation. Miss Wendy Stanton and Falana Jackson. Did I say that right?
Good evening. Thank you for allowing us the opportunity to speak. I'm Wendy Stanton, Social Work Program Administrator. This is Ms. Falana Jackson, and she is our Adult Services Supervisor. So we're here to talk about June is Elder Abuse Awareness Month, and this is a critical time to recognize the importance of protecting our older adults from abuse, neglect, and exploitation. Elder abuse is often hidden, unreported, and can take many forms, whether it's physical, emotional, financial, or through neglect. By raising awareness, we honor the dignity and value of our older members of our community and take meaningful steps to prevent harm. Elder abuse is real, and it is happening here in our community. Last fiscal year, North Carolina received 38,490 reports. This was an increase of 9% since the previous year. Scotland County was one of the many counties that experienced an increase. To put that into perspective of numbers, in fiscal year '23, Scotland County received 69 reports of elder abuse. And fiscal year '24, we received 72 reports. In fiscal year '25, which has not ended as of this point, we have currently, as of this date, received 80 reports. So there is definitely an uptick and an increase in reports that are coming in to be evaluated. This evening, we respectfully present a proclamation recognizing Elder Abuse Awareness Month. We thank you for your commitment to making our county a safer, more supportive place for all residents, especially our elders. Ms. Jackson will present our proclamation in just a second, but I would like to invite everyone, the commissioners, the public, anyone that's listening, on Wednesday, June the 18th at 10:30 a.m. We will be having a elder abuse awareness ceremony out in front of the department, and we would like for each of you to join us if you are available.
What time?
It's at 10:30 a.m. on June 18th.
Good evening. I will be reading the proclamation, In recognition of June as Elder Abuse Awareness Month, whereas North Carolina ranks 9th national in the number of people ages 65 and older, whereas elder abuse is a growing concern as the number of adults over age 65 in North Carolina grows in 2025. 1 in 5 residents will be over age 65, and with greater longevity, there will be more opportunities for older adults to experience maltreatment, whether physical, emotional, or financial. And whereas elder abuse is underreported, overlooked, and often ignored, each resident has a legal responsibility to report any suspicion of abuse, neglect, and exploitation without fear of reprisal to their local county social service department. And whereas in the state fiscal year 2023 to 2024, there was around 38,490 reports of abuse, neglect, or exploitation of vulnerable and other adults made to North Carolina's 100 Department of Social Services. Whereas encouraging, strengthening, and increasing support to prevent abuse allows vulnerable and other adults to exercise their independence and their rights to self-determination, and whereas we must utilize every tool available to ensure our adults, older adults live in confidence and security in their later years, free from fear, harassment, and harm. Whereas the state of North Carolina joins the world in recognizing June as Elder Abuse Awareness Month by taking a stand and making it known that it is not acceptable for any adult to live in fear, be mistreated, or experience intentionally harm. Now, therefore, be it proclaimed by the Scotland County Board of Commission that June 2025 is Elder Abuse Awareness Month in Scotland County, and urge all citizens, community agencies, faith groups, medical facilities, and elected leaders in business to acknowledge the significance of elder abuse as a public health and human rights issue, to learn how to report abuse, and to raise awareness, take a stand against elder abuse, neglect, and exploitation. Thank you.
Thank you, ma'am. Has anybody got any questions? This may sound stupid, but is there an age? What do you consider elder abuse? If he's 59 or if he's 69, or is there an age?
18 and above.
So if they're if they're older than
Any
the one
adult.
doing the abusing is older. Oh,
Yes,
that's
sir.
a stupid question, but anyway. Adult Protective Services. Okay. That was my question. All right. Anybody? No other questions? Thank y'all. At this time, we'll take a motion to the for the proclamation is just read.
So moved.
I second.
We have a motion and a second. Ms. Tyson, you got that? Yep. Okay. All in favor, say aye.
Aye.
Any opposed? Thank you, ladies. And Ms. Tyson will have the proclamation for you later on. Okay, next is our Heart Safe Workplace Recognition. Lisa Monk, Duke, or, no, you're not Lisa. You're not Lisa, but. What's your name?
Tyler.
Okay.
Mr. Chairman, thank you so much for allowing us to come before you commissioners, for coming up tonight for this special presentation. Unfortunately, Miss Lisa Monk was not able to be with us this evening due to a scheduling conflict, but we're excited to have Tyler from Duke University, who will be presenting the Heart Safety Award to the county.
Thanks, Robert, and thank you all for having me today. Sudden cardiac arrest is the third leading cause of death in America, and only 1 in 10 people survive. And interestingly enough, for every minute that goes by that somebody does not receive CPR or defibrillation from an AED, their chance of survival goes down by 10%. When you consider the fact that even for an amazing EMS agency like Scotland County, the average response time is around 9 minutes. So if you do the math, for every minute, your chance of survival goes down by 10%. It really puts in perspective how this is not a condition solved by EMS or healthcare systems, although they play a vital role. First and foremost, this is a condition managed by the community and by first responders. And so in order to help improve survival all across the country, the National Heart, Lung, and Blood Association is funding a trial for us at Duke University, and it's the largest trial ever conducted to improve sudden cardiac arrest survival. And the way we're going about it is we have 30 counties in North Carolina, including Scotland County, who are participating as intervention counties, and 30 counties that are participating as control counties. Now, the control counties are conducting business as usual, but in the 30 intervention counties, like Scotland County, they're committing to doing 3 things to see if this can improve survival. One of them is working with our 911 telecommunicators to see if they can better recognize the signs of cardiac arrest and help coach bystanders over the phone to perform hands-only CPR. The second is to get more AEDs in the hands of first responders, such as fire and law enforcement, who are almost always going to be on the scene before EMS. And this is especially important in rural counties like Scotland County, where most of the fires volunteer, and we absolutely have to have AEDs in the hands of those first responders so they don't come on the scene with nothing there. And Robert and his team have done a phenomenal job with arming our first responders with AEDs throughout our trial. But finally, the third intervention is mass community training. Now, in order to move the needle so that way everybody in the county understands how to do CPR, we can't just do a little bit of training, a couple events here and there. We need to find ways to scale training to reach thousands of people in Scotland County. Honestly, everybody in this county should understand, and everybody across the world should understand how to perform CPR. It takes 15 minutes to learn. You don't have to be certified, and you can save a life. And so to help promote more training in the county and across our intervention counties, we were promoting an initiative called the Heart Safe Workplace Initiative. And there's really just 2 simple requirements. One is that any workplace, any place that has employees, it could be a healthcare system, county government, small business, a church, any workplace that commits to training all of their employees in hands-only CPR, and that has a cardiac arrest emergency action plan. So if somebody goes down, our responders know what to do. Then we are trying to find a way to promote that, recognize them for committing to that type of preparedness. And so I want to thank Robert and the team at Scotland EMS for taking on this initiative. They started by recognizing Scotland Health by training all of their non-clinical staff in hands-only CPR. And then I want to extend our gratitude to you all with Scotland County government that now you all are committing to training all of your county government employees in hands-only CPR, which is, I believe, over 300 employees. And when you think about the fact that about 90% of arrests happen in the home, so it's not going to be, likely it's not going to be out here, it's going to be to the person you love. And so if you understand that as an employee and you can bring that back home, you can save somebody's life. So I just want to say thank you again on behalf of our trial. And we have a recognition for you all, and we'd love for you to come up to accept it. But again, on behalf of Duke, we want to recognize Scotland County for being a heart-safe workplace.
Okay, thank you. Y'all want to go up and take that?
Take a picture.
Hey, if you hold on a second, thank you, Robert. I want to ask Wendy and Philomena to come back and do one for that proclamation with the elder. All right, thank you. Shock out of it. All right, our next item is Crimestoppers request. Chris, yeah, there he is.
Good evening, and thank you for allowing me to come and speak to you. My name is Chris Young. I'm the Assistant Police Chief for Longborough Police Department, but tonight I stand before you as the coordinator of Scotland Crimestoppers. Scotland Crimestoppers initially started around 2007. I maintained the program until around 2011. It kind of set a way to decide, and then at the time, Commissioner Williams, who was then the Chief Williams, asked me to start the program back up. I started doing the research, and around 2020, I got a board together, and we initiated a Crimestoppers program at that time. Since then, it has been doing fantastic. We have a great board of directors. Standing beside me is actually Chairman John Hudson of the board of directors. His wife is also here. She's also a board member. We've got about 17 board members. We are a 501c3. We raise funds by fundraising or donations. That's how we pay tipsters. That's how we get equipment. That's how we fund this program. That's the only way we can do it. It's community members is the board of directors. There is no law enforcement involvement other than we are the coordinators. We receive the tips. We give them to the prospective law enforcement agency for an investigation. If they make the arrest, the board of directors decide on how much money is paid to that tipster. 100% anonymous at all times. No identity is ever provided. From the phone call to the website to the tipster getting his money, there's no law enforcement involvement, no board director involvement. It's 100% anonymous. With this program, that's why community members get involved. Without this program, we as law enforcement have a barricade where we don't get the information we need to solve crimes. This program helps to get that information to solve crimes. We take criminals off the street. We recover stolen property. We confiscate illegal drugs, reduce crime rates, solve cases that otherwise remain unsolved. It alerts law enforcement to potential crimes, performing a preventative function. It saves investigative time and taxpayers' money that works with the community, the media, and law enforcement in solving these crimes. Scotland Crimestoppers is also a member of the North Carolina Crimestoppers Association, which currently I sit as the vice chairman for the state of North Carolina, representing Scotland County. You should have with you our stats for the past 4 years, I believe, except there's one change. In 2025, thus far, on May 19th, when I submitted this, we had 64 tips. That has now changed to 79 tips. We had 8 arrests. We now have 10 arrests since the 19th of May. The in-house that you see, that represents phone calls. The PC web browser is our website, the mobile web browser, and the mobile app. That's why I stand before you today is that mobile app and web browser. Scotland Crimestoppers, we have what they call Navigate 360, which enables the community to use their cell phone as a mobile app. They don't have to go find a phone. They don't have to go find a computer. They can pick up their phone. They can download a free mobile app on an Android or iPhone device. They get a number which is only known to them. They click it, they submit the tip, and keep right on walking. It goes directly to law enforcement's phones. On my alert, I submit the tip. If arrest is made, I let the tipster know through that app, because I can speak with them directly by text message through the app, again, 100% anonymous, to let them know when and where to get their money after the board is voted on. Tonight, that's the reason I'm here. In 2022, commissioners actually gave $1,000 per year towards this program, as well as the city. I come the next year asking for that money and was advised I didn't need to, that it was already set in the budget. In 2024, for some reason, we didn't get that $1,000 and it has discontinued. That's why I'm back tonight requesting that $1,000 be put back in the budget to come to the program to assist with the citizens of Scotland County. This is not a Longborough Police Department or Scotland County Sheriff's Department. This is a Scotland County program. I'm the coordinator for the police department. SRO Cody Gainey is our coordinator for the Scotland County Sheriff's Department. I'll turn it over to Mr. Hudson if he has anything to say.
Speaking not only as the board chair, but also as a supervising telecommunicator for Scotland County 911. I have seen firsthand the effect this has. This program has taken a lot of drugs. It's taken a lot of criminals off of our streets. It creates a sense of security in neighborhoods where people don't have that sense of security. They don't feel they have that voice because there is such a fear of reprisal. This gives them the voice to be able to turn those people in. The same people that we have taken off the streets, our law enforcement officers. And this is 100% done through donations. Donations of time by our board members and donations of money by our community. We humbly come and ask, please help us support our community.
Thank you.
I want to note the board of directors is all volunteers. There's no paid individuals with this program. And just to get perspective, since inception, we've paid over $10,000 in rewards. We've recovered in drugs almost $30,000 of street value. We've recovered through Crimestoppers tips over $66,000 in stolen properties and recovered 49 weapons off the street. Welcome any questions that anyone may have.
Chris, how accurate is the tip line, false information? How accurate, can you do that?
We do get those, and that's why each tip has to be investigated. The more information that comes through a tipster, the better off the chances are of making a quick arrest. There's a difference in saying an individual is hiding behind a tree as opposed to a person's hiding behind a tree at this location, at this intersection. So the more information, the better the tip, the better the chances of making the arrest and getting paid.
Chris, you didn't include this piece. The reason for Crimestoppers was because of disclosure law now in court.
Correct.
Once you give a statement, it goes
You-
to the defense as well. This provides an anonymous tip.
100% anonymous.
Don't have to disclose his name,
Nope.
and he don't get paid unless it pans out.
We don't want your identity, we want your information.
Yes, sir.
Do you get any funds from the drug, I know some of the federal programs that can reimburse the sheriff's department or municipal departments?
Yes, once, if it's based on a tip and they make an arrest and a large amount of drugs and/or currency, because we've recovered cash money, they submit the proper documentations to the federal government to receive a portion of that back after the taxes are done off of it.
On a
So, yes, sir.
forfeiture basis? The
Correct.
forfeiture.
The law enforcement agency will receive it.
So none of the money that you asking for the city and the county go towards the, paying the tipster?
No, it does. It will. That's why we still do our fundraising. We hold events where our fear is when we get to the point where if we have a large case that comes in and we need to pay that, we don't have the funding. And that's where I would come to you guys and I come to the city council to keep that money steady, that we're still going to do our fundraising to maintain the finances in the business, and the business is what we are. That way, if tips come in, I'm able to pay that tipster, and now we don't have any money to pay them.
Okay.
I'll tell you, I'm happy to give you a check personally to help because I think it's a great cause. My question, though, goes back to something we learned in new commissioner training, right? And that's the law regarding the expenditure of public funds. So as I understand it, and Ed'll have to help me since I'm not an attorney, but the expenditure of public funds to a nonprofit has to be for a service that the county would be obligated themselves to provide but cannot.
Or is authorized to provide?
Or authorized. So to me, this, it's an amazing contribution, it's an amazing positive, but based on my understanding of the requirement, we legally can't expend funds in this way.
How did we before?
Well,
We approved it before.
There,
I heard that, but that doesn't change.
Don't make it right, but I mean,
Yeah.
why was it able to go
But
before?
what difference would that make? What if it was ARPA or?
ARPA money?
Yeah, but that's what I was asking, what difference?
I'll be glad to research that.
there is a clause, I don't know what it is, I might have to research too, but there is a clause, because with our board with the state, and from the Secretary of State, they're the ones that I was unaware of coming. They're the ones that direct, you can go to boards, and of such commissioners, city councils, and requesting this, but there is a clause, but I'd have to research it myself.
Yeah,
don't
I
know
just,
what it is.
and again, you know, I think your cause is amazing, your impact, all that sort of stuff, but there's over 200 nonprofits just in
Right.
Scotland County. I think 99.9% of them do amazing work that we could all celebrate and we would all like to give money to, but I think the law was set up this way for a purpose of equity and the expenditure of public funds. And I know opioid's different because there's different rules, but in terms of taxpayer dollars, and again, Ed, correct me if I'm wrong, and
I have not researched this particular, and if you've got something you think qualifies
it.
you to, I'll
What
be
did
happy to.
Richmond County-
Well,
What did Richmond County do, Chris?
Same thing. They
So
know,
they're
yeah.
county commissioners?
There are multiple, of the hundred programs that's in the state right now, there's, most of them provide, the commissioner's office, city council provide to them. But I'll get the exact, because I understand, you know, Mr. Neal's
I mean,
point,
yeah.
but I'll get the exact clause and I'll get with,
him on that. And-
Well, I agree with-
And as far as your budgeting and needing to know, if for some reason we can't do it as a county or board, I'll guarantee the money.
Yeah, I'll
So-
write a check. for-
businesses, we take it businesses and all, so.
Don't worry about that, so far as your budgeting wise goes, so, okay?
Yep,
We
I got
just
some legit-
wanna make sure we're dotting our Ts and crossing our Is.
Absolutely.
And it's a fairness thing when the next nonprofit comes and says, you know, we're doing this or that, and,
Just remember, we say we'll get you.
Good contract with some.
yeah, don't worry, you got my name.
Well, I think everybody up here is behind you.
Right.
On this.
They have been before.
And everybody's willing to take it out of their pockets right now, but I agree with Commissioner O'Neill that I'm not sure if legally we could do that. But we would get Ed to check it out,
Yeah,
you know, see what we can do.
Okay.
I'll get with you on it.
yeah. Thank you.
Both.
Thank
Appreciate it.
you.
Good job.
All right, moving on to the opioid budget discussion, Ms. Sneed.
So, it's the time of year where we will soon enter into a new fiscal year, and so our current opioid programs that you all fund have put in their budget requests for the upcoming year. The opioid collaborative met, I believe that was last Monday, and so the collaborative has submitted the request to you. And so you had what was actually submitted to the collaborative in your packet if you wanted to read over a little closer, but these are the amounts that have been submitted so far this year. I also put at the bottom for you how much of our opioid settlement funds we have received, about $1.6 million. We've expended about $92,000, and we estimate 2.1 million more to come over many years. I believe this was
18?
Yes, I believe it started as a 20-year period, and we're at about 18 left, 17.
But that's still off from what the state site says.
Well, I got this from the state site this week, or last week, and so what happens is that there's so many different companies that are involved in these settlements, and Ed gets the same notifications that there may be like 20 companies involved, and so you get this little bit and that little bit. Some are not settled yet.
Some
And
are
so
still
while-
being sued.
Right, some are still being sued, and so while some of it may be predicted, I guess they cannot lock in an amount until those lawsuits are completed.
But why would they put it on there if it's not gonna be?
Well, what I
I think
looked
the
up,
dashboard said like 5.5 million.
when I pulled every company, it came up to the 2. Plus, now I have not added the 1.5 into the 2. the 2 is additional to come, and we've already got 1.5. And that 1.5 is a fast-moving number because we may receive various settlement funds every month, so we could pull that, and it could change, I won't say from day to day, but it changes pretty quickly.
It just seems like it's a moving target because
It is a moving target. You're correct on that.
when I looked that day, it was 5.5 million over the 18 years.
That was 18.
It was.
18.
I'm just trying to look real quick, but anyway, go ahead, I'm sorry.
So I brought the request to you tonight to determine if there's anything you want to do with these, if you want to approve these, look at these again. We will, once you do decide what you want to fund moving into next year, we will do the correct resolution because we have to send that up to the state to let them know what we are doing.
Well, and it says funds expended. There's still a lot to come out of that for this year, right?
If those are turned in, these are reimbursable. Well, 2 of the programs are run by DSS, and so their expenditures are really on staff salary. The other program, of course, is run by our school system, and those are reimbursable funds. And so I do believe you are correct that the school will turn in some documents to get reimbursed.
Yeah, so in other words, we'll be
So by
down,
June 30th, that 92,000 will be
will
up.
be a 500,000, or what was it?
Could be close,
Dr. Baldwin, 280, was it?
I mean, the whole group is about 500.
Okay, yeah, so will probably be at 1 million funds received and 2.1. So I guess with this moving target, because I've had in my head that $5 million number for years, and now we're 2.1, and I'm not gonna go through looking it
It's
up.
8 million, wasn't it 8 million?
18.
18 million, I mean.
No, it was over 18 years.
18 years.
Yeah,
What was the total?
It was like $5-6 million.
Probably more than that. Over 18 years, how much was
Over 18 years, I thought it was,
How much was it, April, over 18 years? How much were we supposed to?
It moves. So 2 years ago, we were given a number, but as
What was that number? Around,
I can't remember what it, well, I wasn't even in this chair 2 years ago. But and I say it moves because there are still pending lawsuits out there that could raise the amount that we're
18 million or something like
may get.
that. Over the next 18 years, I thought it was gonna be.
I mean, but you're gonna get to, like year 18, you're gonna get down to receiving like 15, 20,000 a year. It's gonna be very small. It started very high in those big years. That's why we've got the 1.5 already in 2 years. And then it's gonna dramatically decrease as those 18 years evolve,
Unless there's some more settlements.
unless there's a lot more settlements, right?
And there was supposed to be in that, was supposed to be a large, like a Walmart, like a one-time settlement. I don't know, I just don't wanna commit, I don't wanna,
about this year, committing to this year, and then we have to look at it going forward.
Well, I think the fact that there's jobs built into this, you sort of end up making a commitment because the school is asking to add an FTE. Are you going to take it away next year?
That's on the schools.
I'm just saying, but every one of these has jobs inside of it as well.
Well,
I got you.
I think if this 566,000 number makes you a little uncomfortable, we could go back between now and your next budget meeting on June 26th and take a look at what it truly takes to operate these programs versus what has been put in the budget. And nothing is to say you couldn't approve a portion in mid-year. If the program is going extremely well, dedicate more funds to that.
I guess my only question would be, we'll say the school, because we brought it up. How many kids are they serving? If those numbers are high, then that's justifiable. If they have a large group, middle school, high schoolers, that they need intervention, marijuana, pills, whatever it be, e-cigarettes, whatever the case may be. If their number is high and they're serving that large population,
that's justifiable. Whether
Well,
they-
but you gotta be careful with that, cause this has
It's
gotta be
opioid
opioid.
only.
I got you. I brought up electronic cigarettes, whatever they smoking, lead to marijuana.
Yeah,
It's all a gateway.
which leads to the next thing, which leads to the next.
Right. But my concern is if they're serving a large number and it's making a difference, and, whether they hire somebody in that position, they need to explain to them, this may not be here 2 years from now.
Yeah, my only concern, I attended this meeting, and what struck me was that there's no allocation of resources based on the whole problem. So when I think about opioids, it's education and prevention. So how much are we spending toward that? Housing, Kimberly McRae brought up, housing is the number one problem, and there's not one penny for housing in any of this. We talked about treatment, inpatient and outpatient. Well, we're spending over half of our budget teaching people the basics about opioids. The fourth area is drug court. I got a note today from the judge, Amy Wilson, saying they're now up to 6 clients. So, the population we're serving matters as well. And then finally, Narcan. So I'd like to see us going forward make some allocation of funding based on the needs of these people because, and I'm going to say this as plainly as I can, this is kind of money from heaven. And I think it's easy to treat it that way and create jobs and do this and do that. But I think the success of this money is based on saving people's lives, saving families, not on creating programs per se, but let's talk about the outcomes. And people are hard pressed when you ask them, let's talk about outcomes. So that's kind of where I'm sitting. So I'd like to really see us change the allocation model, make sure we're doing something that impacts every area of this problem because people are dying and we need to make these dollars count.
And that goes back to what I was saying, I'm more result driven. You said 6 families?
6 clients.
People. Yeah.
So we're expending, and I mean, it's not real difficult math, but I think, we're the number 1 county in the state of North Carolina for ER visits for opioid overdoses. We have to be deadly serious about this, and I just think that if we don't have some rigor around the allocation of these funds and their impact, because I'll be honest, when I ask agencies, talk about your impact, it's a squishy conversation, and we're spending real dollars and there's people in real need.
But we have to have those 6 people to qualify. 6 people.
We do, but it's not just swinging the axe. We got to see the trees fall, right?
This is new. It's new to our county. I get it. It's new to our county. We do have issues. We got issues across the board. And you saying 6?
It was 4, they just got 6.
But I'm looking at a number of them, $100-something thousand. I would like to know what's the results from all of them. How many have they served? How many have they tried to reach? We'll get a better picture by looking at how many have you tried to reach.
Yeah, I think it's just, I'm going to go back to what the county manager said. I think it'd be good to go to a budget meeting, but I think we need to sit down. I mean, I look at our roles as commissioners to be the stewards of making sure that these funds reach the people and make the difference that they need to make through the agencies and nonprofits that do the intervention. But I think it's up to us to make sure that works because we don't want to get to the end of $5 million and go, what do we accomplish?
So do we want to just, what do we want to do here tonight? Do we want to wait on to that next opioid meeting, which is the 16th?
I think at that,
And then we have our next budget. We still have time to do it then, right?
At your budget meeting.
At the budget meeting, but we have to do
This
something
isn't a
during
part
that
of your,
budget.
I say this isn't a part of your general fund, so if you don't approve this by June 30th, you are still okay, because we won't expend the funds
Yeah,
until you
but I
approve
want-
something.
But you're gonna have programs that need to know that.
That's
what-
right,
yeah.
Right.
that's right.
So I guess what are some of the issues with what's been presented?
Running out of money,
Running out of money, but that's.
really quick.
Right.
Well, I think you could.
If we're spending $500,000 a year, we've already got 3.6 and we spent $500,000, so we're not talking about this
Six
being
people.
sustainable very long.
Wait, now, don't do that.
And I do make the point again, if you potentially revise some of what you approve going into next year, there is nothing to say if these programs take off that you don't allocate them more money during the middle of the year. Nothing says you can't do that. It won't affect the general fund because this is a separate pot of money.
Did we get the reasoning? I'm pretty sure there's some increases up there.
There are increases.
There
That,
are.
that's in your packet, what they actually presented as increases. Do you want me to talk a little bit about that, or
I'm just
or if you're gonna talk about it at your next budget meeting, you've got some more time to look at that.
Anyway, do I need a motion for that, or?
No, we can just sit on it. We don't
Okay.
need a motion for that. We can table it
Okay.
until the 26th. But with that said, remind that we do have another opioid committee meeting on the 16th. So you won't be back, though.
No, I'll be out of the country.
We have those every other month, so we would not be scheduled to have that this month, but your collaborative already pushed this through.
Okay, so, all right, well,
So it is, you can send it back to the collaborative, of course, but it's in your hands right now.
okay, so we'll table that till then. Moving on, manufactured home ordinance.
Okay, so I put the language up there. You had asked for our zoning board and our county attorney to take a look at amending language for the manufactured home ordinance and for the county, and specifically how old a manufactured home could be to be approved to be in the county. And so this is what Mr. Johnson has helped us with and come back. And so I believe what you want to pay attention to are two things up here. And one is that July 13th, 1994 HUD safety standard date. So all homes that are going to be permitted to set up, they already have to meet that HUD safety standard, but that would remain. And then it would also layer on top of that, it would not be over 30 years old. And so I believe, and of course Attorney Johnston can correct me or chime in anytime, that the 30 years versus an actual year was put there so it's a constant moving date.
That's correct.
And you wouldn't come back and change your ordinance every year or every few years. So we are not asking for approval on this tonight. You do have to have a public hearing, but wanted you to get a first chance to look at that language and give us any feedback on that. If you have any feedback, clearly we will go back to the drawing board and make some tweaks. If not, we would get it in the paper and ready for your public hearing at your July commissioner meeting.
I'd like to see something explicit in the language that protects people who live in an older home that's going to be moved within the county. So let's say I live in Laurel Hill now and I have a 35-year-old mobile home and the trailer park is sold and I'm forced to move my home. I'm afraid that under this ordinance, I might not be able to move it.
You would not be, you're right. And the zoning
So-
board specifically just took the opposite of the position.
But see, I think it should be grandfathered. If you have if you're an existing resident with a home, I don't care how old it is, as long as it's safe to move along our roadway, you should be allowed to move it within the county without violating this ordinance.
Had that language in the submission to the planning and zoning board, and the board specifically asked that it be taken out, but of course, this board has the final authority on it.
Well, I tell you what, I think that's only fair, and I think if someone loses their home at no fault of their own, we would literally make someone homeless if we applied this.
What is the state requirement? I know there's a state limit on when you can't move it if it's a certain.
78, I think, 74, 78.
I think it's 78 maybe.
So it's not a certain years, it's not a certain age,
Yeah,
it's just a year.
it's a year because what they done is they changed the safety standards in them after a certain year. So I think it's 78.
Okay, so it don't matter how old, long as it ain't older than 78.
Right. But I'm gonna tell you something, there's some 78s that looks like.
I'll tell you, people are living in,
2018s.
Yeah.
And then you
And
got
older-
2018s that looks like
They were built better back then.
72s.
I'll tell you what, and you know, the thing about it is,
How they
these,
keep them up.
these are people's homes. I mean, this is the most fundamental thing on the bottom of Maslow's hierarchy. I mean, people need shelter, and this is for some people that all they have. So I would want some sort of explicit statement to protect those people.
I can
Well, you
reinsert,
said we have the last word.
of course, yeah.
You
But
can,
I can reinsert the language that I had there that would have directly addressed just what you just said.
Yeah.
So for purposes of our process, are you all okay with Mr. Johnston sending out the first language?
Including it in, yeah.
Yes, and between now and still giving us time to publish?
yes.
Yes.
This is an
Okay.
ordinance, so we will
And so
have,
you all can take a look at that, and of course, if you
Yeah, everything else was fine. I just, reading through, I just didn't see,
And it sounds like he already has a paragraph for that.
well, we did.
Put it back in. So ask him to
other-
put it back in. And, but do we put a date on that? Do we say,
I think if it's legal to move on the highway, they should be able to move it.
Should be inspected.
Well, if that's required, absolutely, but if it's safe to move, why not let them move it? I just don't want them to be, because you, like you said, I don't know what the ages of mobile homes are in the county, but I'll bet you there's a pretty good number that are pre-1994.
What you said was the big debate. In addition, the other topic of discussion was whether it be 25 years versus 30. And so the 30-year limitation.
I think I'm
went out.
comfortable with 30, but
Well, that's pretty close to 1994 right now, but it is a sliding scale, so.
that's right.
Every year it's gonna get further away from 94.
And these homes are better built too, so they're lasting longer. People are staying. I mean,
Well, also, when you move one and an inspector goes out, he's checking the electricity, he's checking the plumbing. I mean, he's checking everything that could make it dangerous.
yeah.
So, you know, I really agree with you on this. This is people's homes we're talking about. I mean,
but we're talking about just within the county.
Within the county.
Within the
If you
county, yeah.
currently live anywhere in the geographical county and you move anywhere within the county, you're good.
But not if you sell it.
Yeah, selling it might be a different thing,
You don't
but,
change the house, it's still that perfectly built house.
well, but you're selling it now. So now, I don't know, I haven't thought through that, but this is the one thing I saw, but I'm happy to listen to what might be the arguments
talk about
over
the
sale.
homeowner selling it or the, okay,
You buy mine
yeah.
and you're gonna move it now from Law Hill to Gibson.
I can tell you what the language said before it was
Okay.
redacted out. Any manufactured home constructed before July 13th, 1994 that is already within Scotland County may remain in the county and may be moved and set up on other parcels within the county, provided the home complies with all other ordinance requirements.
That sounds like it'd cover sale.
Everything.
Yeah, that's what I was gonna say. That sounds like it covers sale.
Yeah.
Yeah.
And I can modify that or
Let's make that explicit because somebody's gonna start arguing over it with
explicit
the
to say
homeowner
what?
as far as the sale goes or transfer.
Including sales?
Yeah.
Because I think Duke's question's a good one, you know? And it could be sale or transfer. It could be a grandparent giving it to
Right.
a child.
Sale or transfer, yeah.
Okay, and we'll still schedule our public hearing July the 7th on that. So, all right, great. All right, anything else on that? Moving right along onto our next items, Lee's Mill Road Bridge DOT response. We got a response back from them about the fishing signs and parking signs at Lee's Mill Road Bridge. And I'm looking for the resolution, there it is. So that's the email that came back. from Matthew Kitchen. And basically, it's what he told me before, what I said at the last meeting about he needed a resolution from the board rather than just a letter asking them to do it. And then he goes in, this doesn't have it, but he goes in and adds the state laws to that. So, to say that. So we're back at square one on that.
But he did clarify that there's no reason not to fish on the bridge or park.
Right. There's no state law against it. And they still cannot find any reason that any of it was put up.
Well, and your resolution also is worded so that they make the DOT makes a determination about safety and not us.
Right, yeah,
That's right. We should assume no liability for
Right.
that. That's a roadway.
It's based on them saying, if doing so will not create an unsafe or hazardous condition. So that's where we are.
Do you need a motion or?
We need a motion for that resolution to the DOT for sign removal on Lease Mill Road and Shoe Hill Creek. All right, we have a motion. Do we have a second?
Second.
Have a second. All in favor, say aye.
Aye.
Any opposed? All right. Next, we're gonna move on to our public hearing for the purpose of, to receive public comments on the potential consolidation of the Scotland County Department of Social Services and the Scotland County Health Department and the creation of a consolidated human services agency in Scotland County pursuant to North Carolina General Statute. So do you want to open that with anything explaining, or do you want to just open it as a public hearing?
I could, if you like.
Yeah, I think maybe just a real quick general.
I think kind of what we said before during a previous meeting, commissioners meeting a few months ago when this topic was first brought up, so we could make sure people knew that this was a topic of discussion and where it came from. And so what we talked about then or presented then was that we, as a board and as instructed as a county manager, had been looking at all departments across the county and been looking at staffing and efficiency and budgeting and just at all departments across the county. And we have two departments that are only two departments that are under governing boards, which makes them different from the rest of the county. And so in doing that, I remember saying that it's only appropriate to tell the Commissioners Board also what options they have as a governing board for those departments. And so that's where the discussion of potentially consolidating two agencies came up, because you do have the ability to do that. You have the ability to pick a model of what that would look like if you wanted to do that. And so really this was about doing with two departments what we have done with the rest of the county and with the rest of the county and departments is about consistency and governance. It's about consistency in our personnel policies, consistency in staff being under personnel policies. And so those were the reasons that were presented to commissioners as a reason you could consider this if that's something you want to do.
Okay. So with that said, I'll open the public hearing now to receive public comment on potential consolidation. If anyone would like to speak, you can make your way right up to the mic and just tell your name and come on up.
Hello, I'm Andy Kurtzman. I'm the Vice Chair of the Board of Scotland County Department of Social Services. And I'm here voicing the concerns of the Department of Social Services employees regarding the consolidation of human services. And some of the questions I received were these: what will be the specific changes and effects for the employees? And I have copies of this for you. Will positions be affected by the consolidations? What is the point and reason for the consolidation at this time? Are they going to have a meeting and discuss anything with all of us? What specific improvements or efficiencies are expected as a result of the consolidation? How will funding from state and federal sources be affected? Will there be any risk of losing grants or program-specific allocations? How will the transition be managed to ensure minimal disruption to services? Will there be regular updates for the public during the transition process? What is the timeline for the consolidation process? What protections would the employees have in regards to their jobs and benefits? Will employees no longer fall under the protections of North Carolina's Office of State Personnel rather than the will of the county? As a concern, employees who transfer to other non-consolidated counties, will they lose their years of service? And lastly, will the range or availability of services change for clients currently served by either department? And these are presented to me this week for the Board of Commissioners to consider if they're going to make this transition. It sort of came up as a surprise to me. Why was it being considered in the first place? What do you see as the benefits? What are the cons of doing it? Will it be efficient? Is it going to create weaknesses, changes for the employees, as voiced in these comments?
Can you pass
Yeah.
them around?
I might be one short.
He's got copies, yeah.
I see your executive copy machine.
Thank you, Andy.
Thank you.
Thank you.
If you're short, go ahead. I wrote most of them down.
Thank you.
Just enough.
Okay, thank you, sir. All right, is there anyone else? All right, oh, yep, come on up.
I'm sure you're fascinated by that.
Good evening. My name is Ian Yancey, and I'm the licensed professional engineer that currently chairs the Health Department Board. And instead of boring you with my mentally prepared list of questions from employees, I think that list just supplied by you really summarizes well the questions that I've also received. So I come today really imploring you as our County Board of Commissioners to thoroughly review and turn over and look under the rocks of all the quirks that may come with change. There's a lot of uneasiness in the health department, and I think that I don't know if I can completely speak for DSS, but I think there's some reluctancy on the employees' behalf to speak and ask questions in fear of retaliation if there were questions posed or strong opinions shared. And I can't fault them for that, but I just wanted to share that to you as a board, as your chairman on the Health Department Board. So please thoroughly review what the impacts may be, pro, con, or either. So thank you.
Thanks. All right, anyone else? All right, seeing no one, we will close the oh, I'm sorry. I didn't see you.
Good evening. I'm coming as Tony Spalding citizen today. I'm just curious as to why now, since consolidations of health departments and social services have been, I guess, allowed since like 2012, what's the rationale now? Is there a cost savings benefit that we're not aware of? And if there is, please share that with the public.
Okay,
Thanks.
all right, thank you, sir. Okay, now seeing no one else, we will close the public hearing and start our discussion about this. And just to start that by saying turning over rocks, we've been turning over rocks now for 6 months on this. A lot of stuff behind the scenes have gone in. I don't want to speak in a general blanket about this, and we'll try to get specific questions, these questions answered and out to the staffs. But honestly, I don't see, from an employee level, I don't see a big difference at all. You'll still be at the same place doing the same thing, and go ahead.
Only thing I will say about information to staff is we did give out information to staff. And I hope that was shared with every staff member of DSS and the Health Department. And what that was our personnel department took the State Human Resources Act and compared it to our Scotland County personnel policies to see how they mirrored, to see that there is very, very little change from what we already practice to what's in the State Human Resources Act. And so that was shared with staff, I think, at least 2 weeks ago.
Okay.
Tim,
Yes, sir.
one thing you said is concerning, when you have employees that are frightened because of retaliation, we need to take that off the table. Everyone should feel free enough to express what they feel, not worrying about their job being in jeopardy. And I'm pretty sure everybody up here feels the same way. I just need to get that out there. My question is, what if there was a consolidation? You know, I serve on the DSS board. What would their board look like?
So that really would depend on if this commissioner board determined to consolidate, then you also have to determine which model you would like to follow. And so there's two models, one being that this board becomes the governing board and you still keep members of health and DSS boards as advisory boards that would still meet regularly, still hear program updates from the directors, and still have input into the operations, especially program operations and maybe citizen client feedback as to how those departments are operating.
I want to say over 10 years ago, it came up. I'm sure went through the minutes.
I remember it,
We,
yeah.
but it was talking about consolidation in city and county, but never just narrowed down to 2 departments. But what they were trying to do is sheriff department, police department, city and county, but just narrowing it down. And I think I know we did. We just didn't bring it back up again. I don't know about it.
But that was including the law enforcement. This
Tax.
this
They
piece
talking about
doesn't
tax.
include,
Yeah,
yeah.
taxes.
Taxes,
I mean,
law enforcement.
consolidation, the whole county and city. But we didn't narrow it down to 2 departments.
I think from what I'm hearing, I can speak for the board I serve on. Their, I guess, major concern is why now and why do we need to do it? Why now and why do we need to do it? I mean, they just want a simple answer that justifies why there should be a consolidation. And I don't think we're giving them that, or they don't feel that we're giving them the reason why we should do it and why we should do it now.
Well, I mean, there's efficiencies tied to that too.
There can be.
Of course. But I'm sorry, what?
Efficiencies.
And we will get that out, but, I lost my total, what I was gonna say.
Well, and I feel like what I've said in a previous meeting, and I've said again tonight, it's really up to you all as a board to determine, do you want all your employees under the same set of policies, or do you not? That's one reason. And that's honestly just a choice to make. There's no right to answer to that, and there's no wrong answer to that. Do you want to have a more governing approach to DSS and health? And that's up to you. There's no right or there's no wrong to that. It's just up to you. And so I've said that, you know, how consistent do you want to be as a county? Or do you want to continue as we are? And that's just the reason. It's an option, and I would not be doing my duty as we review all departments not to tell you what your options are.
Yeah. I'll tell you, for me, it's been, I serve on the health board, and I've heard people have said very plainly their concerns. I haven't seen any reluctance to do that. As a matter of fact, they've done it kind of out loud. I think it's integration of services. A lot of the clients who go to DSS also are serviced by the health department. I think there's opportunities to integrate those services and make it seamless. I think sometimes it's treated as two separate things when there's an opportunity to work together for the benefit of the client. And I think it's easy to lose the client and start thinking, we're DSS, this is what we need. We're health department, this is what we need. So I'd like to see a greater integration of services. I'd also like to
Ma'am,
see.
this is not public comment
That's
time.
all I was coming
This
to
is
ask.
board discussion.
That's
So
what I was
this is
asking,
board
'cause I
discussion
wasn't
time.
sure.
Okay, have a seat and we'll get to you in just a second, okay?
Oh, so I can come back up?
You can ask whatever question you want, but we've already closed the public comment, and we are in board discussion right now. So this is just
Yeah,
between.
that's what I was actually coming up to ask, so thank you for your
Okay,
answer.
yep.
I think the second thing for me is a real push to the community. I hear a lot that people don't want to come here because of the stigma or whatever, and I think we have to reach out in the community. We have a mobile medical unit that hasn't moved in the community since last August. And, you know, we ought to be out there providing whatever services we can provide to the community. That was the whole intention, to go to Wagram, to go to Gibson, to go to Laurel Hill, and get out there and see people because they don't have transportation, yet we say they're not coming here. Well, that kind of doesn't make much sense. I think the employee clinic idea, I think we've talked about a lot of different things. When I talk to Scotland Healthcare Center or Scotland Healthcare System, they're enrolling people in a program for people who are uninsured, and they're treating the uninsured. Well, I thought that was our mission, right? So I see them in an entrepreneurial way getting out there, enrolling people, providing services, and we're kind of waiting for people to come in the door. So I really wonder, I think this is a reset. It's an opportunity to get out there, get some visionary thinking, and make this a valuable resource instead of something that people say, there's a stigma. Well, you know how you take away the stigma? You get out there with people and you make it normal and natural. So I guess I'm in favor of something that's going to create a step change in our system. Everything from reception. When you walk in over there, why can't you go into one place and get help from either agency? Why is the lab closed during time that DSS clients could be coming in and getting service? I just think we need this partnership. We need these activities operating in an integrated way that makes sense and delivers the greatest value for our citizens. And I think it's a fair question. Now is the time to ask the question because we're thinking about it, and it's something that I believe makes sense for our community.
Tim,
Yes, sir.
what's the pulse of surrounding counties?
Right. Richmond County.
I think Richmond's
What
consolidated.
about Hope County?
They're not.
Robinson's consolidated, Richmond's consolidated.
About
I
Hope
think
County.
Robson's,
I'm not sure about Robson.
I'm not sure about Hope,
It's been very.
Not sure about Hope.
very recent.
I don't know. I don't
but I
how
know
many-
Richmond and, Robinson is consolidated.
There's, in the information I provided you before, and I can find it, is a list of how many counties across the state have gone to that. I want to say it's close to 40, give or take, 2 or 3, either way.
And any of them reverted back.
No, sir.
Well,
And it's
it don't
mostly
make a lot
rural.
of- It don't make a lot of sense to me when you got two different departments in one building. And you got two different boards in one building. That's running two different departments in one building. And when you got the two departments that work with each other, I mean, it should be one department. I mean, to me, that just makes sense to me. So, you know, I have to say I'm for it myself.
what about the citizens? I mean, excuse me. County employees, citizens too. I mean, we are elected by people.
Right.
And before I make a move to do that, I want to hear what they say. You know, that's how I've elected all these years. People and speak for the people. So before I can even say anything positive for consolidation, I want to hear from our citizens. That's how I always voted. If they say no,
Yeah.
I go by myself. I've been voting by myself lots of time anyway, so if I have to do it again, I'll do it again.
Well, I can agree with Commissioner McFadden.
Well, we just had a public forum.
Well, we need to do a survey. We need to go beyond. We need to do some type of survey.
We just done a public forum. I'm
Yeah,
ready.
but-
I'm making a motion to consolidate.
Yeah, but we can't just make a decision based on.
Well, hold on. You
we
just
don't
had a
need-
motion
We
made.
don't,
I make the motion.
You just had a motion
I'll
made.
make the motion. Consolidate.
So is there a second to that motion?
I'll second it.
We have a second. Now we can discuss that motion made.
But I think it's a fair question. I'm hearing some rumbling like we didn't have a public hearing. Are you gonna reopen that again, or?
We just
Okay,
had
so
a-
we've had the public
Had our
hearing.
public hearing and
we
it's,
need to approach this.
But this has been going on for
got
2
you.
months. Everybody knows about
We
it
need,
for 2
we
months.
need to do the same way we do IEJ. We need to get the public involved.
all right, so do we need to, with this motion on the floor, do we need to assign the option of, which option? I forget the names of the
Yes,
options.
yes. Well, your options are largely, if you vote yes, will your commissioners become the governing board? The other option is you vote to consolidate and you leave 2 governing boards just like they are now.
You have to address
I'll
the
go back
State
to the
Personnel
motion.
Act too.
Okay, so
Yeah.
you want to amend your,
I want to make a motion that the commissioners are the governing board.
okay, so you're amending your original
You're right.
motion?
Yeah.
Okay, and is that okay with the second, Ed? For the second on it?
I'm really trying to ask myself, is there more wisdom in making one decision about consolidation, and then if you do go yes there, then having a separate opportunity to look at the exact form of that consolidation, of which model you use? I think that's a separate discussion, and I think that's a little more nuanced, I think, and
He's
I mean,
right.
if it's possible to divide it in 2, that would be my wish, but
Divide the motion.
Don't know.
yeah,
Can you do
I
that?
think
Well,
Once you
you,
vote,
you
it's
can,
done.
you can decide whether you're gonna consolidate and then separately in a different motion,
think we
which
do that.
model you choose.
or even at a different meeting, perhaps at our next meeting, address the issue where,
What's the effective date of the consolidation gonna be? then?
well, if you were to ask me, I'd want to see consolidation like October, November. I would not want to see it immediately. I'd want to give time to transition,
Well,
to
if you-
plan,
If
you
you're gonna
know.
wait that long, you could certainly do it at another meeting, but.
I would
Okay, so let's, hold on. I gotta get these motions right. So
Okay.
I got an emotion amended.
Amended. So let's go ahead and make a motion to move forward with consolidation.
So withdraw your first one.
Withdraw with the first one.
And
Let's,
you withdraw your second on the first, right?
Yes.
Okay,
okay,
so now
let's
redo
make a
your-
motion to consolidate the 2 boards the two departments, and later discuss in another meeting on how we're gonna do, is it gonna
The
be?
governance.
The governance of the boards, yes.
All right, so I have a motion. Do we have a second for that?
I'll second that.
Okay. Any other discussion now?
I mean, tell me, we gonna do away with health department board, social service board, and the county commissioners are gonna be,
No,
what are you talking about?
No.
That's where it's headed.
I know.
That's what it sound like.
That's what I'm talking about.
No, they're,
We're not gonna
that's
need the
gonna be a
boards.
different.
either way, there's gonna
discussion.
be a board in both places.
Well,
Or
by
a
law,
consolidated
you still have to have the advisory board because of the required members who are physicians or whatever that are required for
That'd
membership.
be a different meeting now.
Yeah,
Like we said,
But
Commissioner
eventually
O'Neill
gonna be the
gave the
ultimate
second.
making decision. Right now, the boards are making the decision, and the commissioners, we're there for support, but if we do this consolidation, abandon the boards,
You don't, they just become advisory boards, and then
Instead of
this
paid
body
boards.
would take advice from them. Just like many other advisory boards do.
Well, and that's how all our other departments are
Planning and
structured.
zoning.
yeah, planning and zoning, that type of stuff, so.
same thing.
Okay,
Yeah.
any other questions? Tanya, did you have something?
No,
thought you
I was
wanted-
just worried about the employees, because if they
Oh,
had questions,
it's
I
not
feel,
gonna
I
affect the
feel that,
employees.
well, I feel that we should answer their questions.
Yeah, well, she's
I
gonna,
don't have the exact answer, so I can't.
she's
answer
gonna
them.
go through this specifically, and I hope send that out to everybody.
Absolutely.
So-
And I think what you sent
Because-
before,
With the other documents.
Because
in.
I don't think it's gonna, employee-wise, it's not, you're not gonna see a big, if
I know,
anything.
but sometimes employees run the county.
Yeah, I get it. All right, so we have a motion and a second. Any other questions, discussion?
I need
Miss-
clarification.
Dorothy, are you clear on what we're doing here?
Yes, sir. The motion was, the first motion and second was withdrawn. Now the motion is to consolidate the two departments and to decide at a later meeting, what the governance will be.
Okay, I think we need to amend the date in that.
yeah, I was just saying if it were up to me, if I were to pick an implementation date, I would pick something out in the future. But I think perhaps at our next commissioner meeting, we could have a discussion around which model.
Yeah, but we need a
If we-
date to put in this,
Would you say before October?
or October first, or
October.
November first.
I'd say November 1st. Give yourself time, give employees time.
Yep. Okay. All in favor of that motion, say aye.
Aye.
Any opposed?
nay.
Nay.
Okay. That was nay,
That's
nay, in time, so, okay, 4-3, okay. So the motion carries. All right. Thank you. Next order is board appointments.
Okay. So we got the RCC board, I'm gonna make this an emotion. So we got the RCC board, got one vacancy, be Dean Nichols.
And that's a
RCC.
reappointment, right?
That's a reappointment, that's correct, I'm sorry. So, and on the Tourism Development Board, we're gonna have two reappointments, which is Glenn Batten and Jeremy Baker, and then three new appointments, which is Devon Goodwin, John Ridge, and Derek Martin, I'm sorry, Derek Martin. And on the LRCOG Workforce Development reappointment is Brent Barbie and Commissioner Tanya Edge. I make that in the motion.
All right, we have a motion. Do we have a second for those appointments? All right, any other discussion? All in favor, say aye.
Aye.
Any opposed? Thank you. All right, county manager report.
I will point out this quickly so people can see, pause there for a second, that there are still open boards in Scotland County. So if somebody is looking to serve their county or has a particular interest, here are the open boards in our county right now. So take a look. If you have any interest, feel free to give Ms. Tyson a call and she can tell you a little bit more about that or how to apply for those. Sorry.
Go ahead.
North Turnpike Water Line. So continuing, as I keep saying, seeing things on the back end. Over the last month, we've been working on permission for temporary construction easements development and acquisition agreements and engineering reports, still having to send things up to state agencies like DOT to get signatures before we can put that project out for bid. You did ask me last time for a timeline when we thought it might go out for bid, and we were very hopeful that we would be able to publish that bid so we could get contractors' bids back in August of this year. Subdivision ordinances, you also at one of, I believe at your last meeting, were interested in work on subdivision ordinances. Your zoning board created a committee that will meet for the first time in early June. I believe that's the 9th, so they can start looking at those and bring you all some proposals back for change. Our Veteran Services Office just received an $18,000 grant. We're glad of that because that can be used for about 4 months to help offset the cost of salary. We hope to purchase a case management system for that program that will be extremely helpful. We have one veteran services officer in our county, so she juggles as many claims and as many questions as come in, whether that's 2 a month or 200 that month. And so this case management system feeds directly to the state, and so once she keys in information, she is not doing repetitive keying and repetitive filing of claims and using fax machines, basically. This will make her progress move faster. We also vetted this with other counties around us and across the state, and the one we would like to get works very well for them, and it's a minimal cost. I mean, the program's like $2,000, but the grant will pay for it. We can also use the grant to enhance our Purple Heart status in the county. We are a Purple Heart county, but I'm not sure that anybody knows. And so we can use grant funding to get signage up and to get information out and hopefully make sure people understand that we do have a Veteran Services Office here. Departmental performance report, that is something you asked for a few months ago. And so I pulled together information that department heads sent in. And this was the first time, at least that I can remember, that we've asked for anything that specific from them. So you'll see it's kind of I'm not gonna say a hodgepodge of information, but every department is so different. You know, not every department you can look at and say, oh, what did your state monitoring say? Well, some departments don't really have a state monitoring. So you may see measures for some departments where you don't see measures for other departments. So I pulled them together into one document that you could take a look at and see if that's the type of information you're looking for as we move forward into the upcoming year, or if there's more information you would like from departments just to see, you know, what's going on and how they're doing. And I especially like the internal goals that they set for themselves, and they're very honest about whether they meet those internal goals or not, because, you know, you set a goal and you hope to meet them, but you can't be 100% successful 100% of the time, but you keep working at it.
And maybe we can figure out what we need to do to help them.
Absolutely, and you may see something on there that triggers something for you exactly to say, hey, we could try this to help them out. In new business, we have an easement request. You had a diagram in your packet from the city of Laurinburg where they are running a raw water line and need to go through our easement. It looks like this. Sure. It's a very narrow strip of line, and it showed you on the diagram where they would run that easement through. So they need permission to do that.
Is that the one out at the New Johnson School?
I'm
Old
sorry.
John's.
No, that's, hold on, I had it in my notes.
It's Old John's Road.
It's Old John's Road and goes to the treatment plant at Lockwood Drive, of course, where their treatment plant is.
That's the one, I thought we already had an easement through there. Because I thought they ran that sewer line from the school down through there.
We may, but what I was gonna ask was, if the location's agreeable, whenever they do the draft, I'd like to be able to read the draft.
Okay, absolutely. So I'm not sure if that's something you all need a motion on, of course, depending on Mr. Johnston approving of their language and their draft.
So who assesses the impact of this easement for us? I mean, we used to have a county engineer that could look at these and go, in
Can
my
I see that?
professional opinion, you know, who does that now?
Now we are dependent on the city of Laurinburg. Of course, we contract with them to provide water services.
Old John's.
As you are correct, we don't have an engineer. Of course, there are times, Mr. McGirt, if it's something, that was in a park or something like that.
Well, at
then
the
we might-
EDC, we have a contract engineer for a project.
If we
is-
contracted,
Could we potentially, I guess I feel like we're making a decision about something without the advice of a professional engineer to tell us, yes, this easement presents no long-term problems.
I'm sure an engineer would be glad for us to pay them to.
Yeah, yeah.
Right, I mean, they're not gonna do that without cost. So yes, we could.
Agreed, but I mean, those are just lines on the paper to me.
Me too, and
So-
I'll admit,
I mean, I think Ed can, I don't know, but we originally gave them all right, so we had to take that land. Remember, we took the land, the person was in California, we never could contact them. And we took that piece of land through there and they ran the sewer line.
Well, there was an existing easement for the city as well.
Right.
But this is
I'm just curious as to why this is the same place. It looks like, just as rough as this map is.
Can I see it?
That's Old John's.
I guess, April, my only concern would be that somebody would tell us, yeah, based on what we see here, this doesn't present a problem for us in the future.
right.
And then we're happy to grant it, or consider it, but
I mean, it has to be our land for easement anyway, right?
Yes, that's why they're approaching
That's what
you
makes
all.
me think that it's that land that we had already done all this on, back when they were building the school.
Do you think it's a different, portion of the parcel?
Well, if it is, it wouldn't be ours, because we just took a narrow piece of, for the lack of a better word, eminent domain, I guess, but,
I can check into this.
and we took a
I mean,
narrow piece of that.
I will be glad to continue to investigate that, but they clearly believe that is our land, and
Well, I'm
maybe
not
they
saying-
don't remember.
If that's the
it's
same
already
one, it
granted.
is, but I think we already gave them a utility easement through there, so.
Do you have to have an additional approval for different utilities?
I don't know. So if you ran a
So-
water
so
line
that
and
may
sewer
be-
line beside each other on the same, you'd still have to have,
So
maybe
that may
that's,
be why they're coming.
maybe that's why. I don't know. You can find out, then we can take care of it on the
Yeah,
26th. right?
absolutely.
okay.
Now, is that the new school here?
That's what I'm thinking, or the way the map looks. The zoomed out map.
I can also ask them to provide us a map that's not so, close in
Give
to
us
where
a
the actual
landmark or
easement is
something,
to
yeah.
kind of, zoom out.
I'll tell you, I think we want to be a good neighbor with the city, and, I'm just concerned, is there any potential problem that we don't see because we're not experts on this? If somebody would say, it looks good,
Okay, well, you'll get all that
Yep,
together for us.
I will get some more information.
Okay, let's go on to the next.
EDC update, just an update tomorrow morning at 11 o'clock. EDC is breaking ground on a new 45,000 square foot shell building. That building is being built with grant funding from Golden Leaf, so we would invite everybody to that. And that will be out at our industrial park where Wallace Way is, if anybody wants to attend the groundbreaking. And then finally, I put a list on here like I do. Wow, sorry, I had that in my PowerPoint the whole time. A list of upcoming events in Scotland County. This is not all inclusive to everything in Scotland County, but this is what our county is hosting and what our different departments are doing. So I think it's important for you all to see, we're pretty busy and we're offering things to our citizens almost daily that they can participate in.
yeah.
That's my report.
All right, thank you, ma'am. And we'll start, Commissioner O'Neill, do you have anything?
Yeah, so we had a community meeting at IEJ on Wednesday evening, and to discuss just the community's thoughts about opening up some more of IEJ and what are the challenges to doing that and what is the opportunity there. And we had probably 80 people attend, and I thought it was a very good event. I think the community came out. But I think the takeaway for me is that I think we ought to look at establishing a citizens board for IEJ, a group of people that would be involved in helping us understand the needs of that community and the people in that area and what they want there and what services they need. And then I think the county can do the scheduling and help in making that facility, integrating those other classrooms with the existing facility. But I would like to see some people from the community who are pulling together insight and what they want and advising us so that we're not out here doing things that aren't in line with what the community wants.
From that, are you saying that the county go forward with phase 2 and 3, which we promised to take place at IEJ? We promised that going in.
No, I've never said those words.
No,
What?
I said that was the original plan.
Oh, yeah, so I'm not gonna speak to the original plan because all the money's gone that could be used for phase 2, right? I understand that 2.5 million was spent all in phase 1, so there's not money for phase 2. And the big blocker for phase 2 is the bathrooms. Without bathrooms, you can't get a certificate of occupancy. So what I'm suggesting is that it's gonna take a substantial amount of money to do that. I think what we do should be guided by this advisory board from the community. And I think it would be something that people would welcome. And I think it also opens up some opportunities to maybe get this work done in other ways that the county cannot afford to do it. But I do think we have something to contribute to this.
We couldn't afford to do Laurel Hill, but we made it happen.
Right.
Get that now.
Commissioner McFadden.
But what we spent on Laurel Hill, we could have built something new.
Got you, but
I don't think, this is not gonna be, Johnson's not gonna be that much.
Well,
I know that.
if you look at that paper that went out with it, it's a $500,000 estimate.
Yeah, that's
And I'm saying that I think nonprofits and a board could guide that process and probably do it much more cheaply, and we could.
That's your opinion. We met with other folks. We met with folks who want to come and do some things at IEJ. We were open-minded about that. We listened to the proposal. You know, I'm not saying go that route, but this, kicking the can down the road. We just made a decision on consolidation like that. But now with this Johnson deal, we need to come up with a board.
No, but I'm saying that board could look at this process about who else, what happens there. This board could look at that first, right? I mean, it's not about going slow, it's about going smart.
Yeah, it is about going smart, but at the same.
I mean, and so far we have not, I keep saying we need to listen, we need to have people involved in this, and I'm suggesting a mechanism that would get community people involved in a way.
We had a room full of people at IEJ. If anybody was there that night, we had a room full of people with kids that's ready to see IEJ move forward, ready to see that building utilized.
So, I mean, because I wasn't there, move forward doing what?
Anything other than what it's doing now.
So what we had there, there was 3 commissioners there, and we had a community meeting there at the school, just to kind of bring you up on the speed here. And so we had a room full. It was a room full. I'm
We
gonna say
talking more tonight than we did that night.
actually, yeah, it was a room full, and everybody was pretty much in favor of moving and doing something with IEJ. Now, but I'm gonna come back to that in just a second. But now, Representative Pierce got us $500,000 for IEJ, and I think we used 200 on air conditions. Is that right, April? You don't have to be exact. You don't.
No, I can't be exact. Out of the 2.5 million, we have, I hate to even say what we have
But
left.
I'm talking about for the parking lot, though. for the parking lot.
That's what
He
I'm
had got
talking
his
about. That's
500,000.
all we have left is
Right.
a limited amount of money.
Well-
And that's what it was earmarked for.
What my recommendations is that we take what we got left and get the bathrooms in working order. Because I looked at the
Because of
parking lot,
what? Because of what? You can't do anything with land, no way, till we
on
get
kind
approval of that
on
under
kind
environmental
of
study.
environmental study, that's correct. So I would say instead of just, get the bathrooms working, use it to get the bathrooms working in the facility. And then let's look at, maybe, doing something with some nonprofits, like you're talking about there, with some nonprofits.
Well, and this
on
goes
different sections of
this goes back to when we originally had this, and how many years ago?
Y'all were here.
The issue, the issue is the reason that parking lot has to take priority is because you can't put anything else in that building and meet the code for the city unless you have X amount of parking. You gotta have so many parking places for X amount of space that you're opening. And we're kinda almost to that limit now.
Even if it's a nonprofit?
It doesn't matter what it is.
Right,
You
it's
got to
about
have-
occupancy.
Yeah, it's
Okay.
about the occupancy. So you got to keep, that's why we've held this money, well, it's earmarked for it anyway. We can't use it for anything else. But, that's why we've held that so long, was waiting on this environmental study. And we got to have the parking space
Okay,
done.
okay.
That's why.
Well, that cures that. Now I'm gonna go back to what I was talking about a while ago.
He can't avoid it, and I can't. Parents can't avoid it.
Okay.
Folks gonna constantly ask him about
So-
phase 2 and phase 3.
So we were approached by a nonprofit organization that wants to come in there, and I forgot how many kids he said he had, 200 I think, or a little more, but wants to come in there and lease the whole front part of the school from us, and we've had some discussions with him several times, and I think that's something that we might need to really look at. If not him, somebody else, but we need to really look at it.
This started, the wheel was turning with Tim and Clarence before we got on the board. I'd like to hear their take on it.
Well, let me finish first. It's my turn right now.
It's actually Ed's term, but go
Okay,
ahead.
but I'm talking right.
That's okay.
I keep getting interrupted over here. Anyway, but I think that's something we really need to look at and consider. I think we need to, like Ed said, I think we need to look at really considering getting somebody in that building, nonprofit or whoever, to help the community, to help kids. Now what he says about making a community board, a small community board, I like that idea. I think that's perfect. Rest of you might not like it, but I like it. But I'm not talking about dragging this thing way out either. I'm talking about, getting something done on it, because the longer we sit on that school, the worse shape it's gonna get in. Because you know what, like everything else is, if you don't use it, it's gonna go down. So, that's my 2 cents.
Okay. All right. Anything else? If not, we'll move to
No,
Commissioner. We're
I'm
going
done.
around the table.
I'll tell you what, we'll come back, I'm sure we'll come back to my suggestion later, because has happened a few times. But I do think we need some mechanism to stay connected with the community. I think the bathrooms issue, I think April mentioned that they're gonna be doing another walkthrough and looking at the cost and reevaluating that and asking ourselves, because that is the long pole in the tent. The classrooms are huge. They're really in great shape. I was shocked when I walked through, because I had this picture in my head, but when I walked through, I was like, wow, this is fantastic space. And it can be utilized. So I think there's an opportunity here. I saw people who want to be involved and who have ideas and passion and can help raise some money to get this done, and I think it's a worthwhile thing to do.
Okay.
That's all I have.
Commissioner Shelley, anything? Commissioner McFadden?
Yeah. I think I'm part of this board too. I think we're constantly presenting a bad check to the black community, especially when it comes to Johnson. And then when we're gonna do something for other, Wagram, Laurel Hill, no question, push it. push it through. But when it comes to, we gonna send them a bad check, send the black community a bad check, and they hold their head up like they ain't did nothing. I think we need to stop that.
Okay. Commissioner Edge, anything? Commissioner Williams?
Well, I have to agree with Commissioner McFadden. You know, we want to include the legacy of Johnson in our decision. Johnson is dear to him and me. We walked the halls. And I know, Ed, you hear that, you may cringe, but I walked the halls. And I know the atmosphere over there. It's like me telling you about Rohanna, Richmond County school you went to. I walked the halls of IEJ. I know the heartbeat of that community. I do, because I walked those roads over there. So when we do speak on IEJ, it's coming from a special place. I know it is with you. It's not politics about IEJ with me. It's about the legacy of IEJ, because it's bigger than the school. The history behind the man and its purpose. So what decision we make about IEJ needs to be on point. Not playing politics, not playing egos, who's right and who's wrong. It's what's gonna be right going forward. We made a promise of 3 phases. We had 1. How do we get to 2 and 3? I don't know, we need to figure it out, because they're expecting it. And we're not gonna play games with it. We need to provide something. That's just my take.
So can I comment on that for just a second? Because I'm not aware, and I don't know if Ms. Edge is, Ed may will. I don't know what phase 2 and 3 is.
We were just before our time.
That's what I'm saying.
Yeah.
And I'm not saying I'm opposed, I'm not saying I'm
Right.
for it.
Inform
Heck,
us.
fire, how am I supposed to even vote if I don't even know what it is?
Well, to go back to what I was saying, the original plan, when we had that meeting with the community, the first phase was, tell us if you want to keep the building or if you want to tear it down and build a new one, right? Because it's about the time Laurel Hill was started or somewhere around that time. Because it was gonna roughly cost the same amount of money. And they were very adamant on keeping the building, redoing it the best we can and get it back up to speed. So that's why it was started in the section that was started, which was the gym and I call it the old library.
So this
Anyway.
is phase 1.
That was phase 1.
Gym, library.
Right, and what we could do toward the front door. CCAP came in the meantime and wanted that annex building for their operation. And they wanted the land behind it to where they could build housing. It's great, they've got, or can get the money, that's fine. Here comes hang-up number 1. We can't move nowhere else until that parking lot is done. The hang-up is we can't do the parking lot until the environmental does their survey. It's been going on for 18 months or more now. But we got the money. We can't touch that parking lot until the environmental study's done for the land behind it. It just.
So we can't even let a nonprofit have it or nobody move in there.
We can't do nothing
Parking
yet.
lot
We
stuff.
can't change
So
the
how
deed.
do we move environmental along?
That's,
Because that seems like there's your stumbling block.
right, we need to find out whose
No, it's
desk
not a
is sitting
stumbling
on.
block, it's a great big wall.
I've been
Right.
told it is sitting on the desk at the state, at Encore. And so last week, I got in touch with them and said, where are we at? I understand it's sitting on your desk. And so this week, I saw an email between the state and SCAP asking several different questions. So I'm hoping that means they've picked it up and begin to look at it.
But that's kind of, money's a big part of it, right? Of course. But that's kind of the stumbling block that come in here was, yeah, we'll give you the land back there to build the housing on, you get the money to do it, in which they're very capable of doing that. But the environmental survey stopped anything going on over at IEJ property because right now it's all one big piece of property. We can't change the deeds, we can't do any surveying, any of that until this environmental survey is done. And forget about them taking the annex or not taking the annex. The land behind it, I assume they still are planning on the housing back there. So,
They haven't spoke about it because of this IMB.
right, because they're waiting on the environmental.
So have we contacted Garland Pierce and Danny Britt
Well, I
and
think we
Mark
find out
Harris?
whose
And
desk it's on. And
have
then
we
can
gotten all
contact.
those people engaged in this? And
Well, and SCAP, they have been responsible for getting this environmental study. They have done that, and so they are who is related sitting on somebody's desk. So I'm going on their word that it's done and it's been submitted, because they are responsible for that.
Well, let's ask Dr. Whitaker tomorrow to find out.
Well, and that's what I've
Who-
done.
who's-
I've
where's it
asked.
at?
I don't know that they can tell us whose desk it's on. You know, you submit it to the state and it goes
and if
where it
there's
goes.
somebody we haven't tugged on yet, let's go tug on them and say, give us a hand.
Yep, okay.
I'm sorry, I guess Tanya's up.
Yep.
You go ahead.
Yes, sir. Now,
Oh, I'm sorry, I skipped over that.
I work 80 hours a week, every single week, every week,
Me too.
I remember working
7 days
part-time.
a week. If you sit over there and say that I'd give an IEJ a bad check, how many meetings have you been there on? I've been there, well, you just said we're handing IEJ a bad check. How many meetings have you been on IEJ trying to make this happen? Because I've been to a bunch of them.
Committee and community, they ain't gotta worry about it.
You ain't even on the board.
They ain't got to worry about it.
okay.
You ain't even on the board.
We don't want to
And
start
you gonna
that.
sit over there and say, yes, I am going to. You ain't even on the board, and you gonna
On what
sit over
board?
there and say,
On what board?
you ain't on a board, you ain't on the DSS board, you ain't on no kind of board.
Yeah, yeah.
Been
That's
there,
offensive
done
what
that.
he said.
Been there, done that.
Well, you a commissioner, you should do it now, instead of the rest of us having to take your slack up.
Been there, done that.
Well, that's all right. Let's,
Okay.
Well, you sat over there and say,
let's do
that we
that.
give IEJ a bad check. But let me tell you something, we spent just as much money at Laur Hill. Wagram come up with most of their own money, but we spent just as much money at Laur Hill as we did IEJ. I've been over to IEJ 10 times in the last 3 months, and you gonna sit over there and say we giving
I ain't
IEJ a
trying to
bad check?
micromanage though. I'm not trying to micromanage.
Not trying to
Just say
micromanage
here.
either.
You
I'm trying.
put
You don't have to get upset. I'm trying to make something happen.
I'm not micromanaging that.
I'm trying to make something happen, and you sit over there and say that we're giving IEJ a bad check. Sir, I think that is disrespectful.
All right.
That is a disrespectful remark.
All right.
No, don't boo me. That is
Well-
a disrespectful remark.
All right, we're gonna stop right there.
That's all I got to say.
The only other thing I had to bring up was June the
don't make no
16th
difference.
at
He
10
should say
o'clock
over
at
and
the
say that.
City Hall will be a Transportation Committee STIP meeting for highway projects in the county. I do want to ask for the public to be on the lookout, or for somebody to, if they will, let us know who stole the automatic defibrillators at the parks. We've got people stealing automatic defibrillators at the parks, can't do nothing with it.
And who's driving?
And
who's
also
taking the
who's
kids
tearing down the
driving
fences
our
to go out
parks?
and do donuts on the field. And this is more than one location. That's childish. Somebody knows who did it. And, so, anyway, with that said, we will recess this meeting until our next meeting, June 26th. There's a correction there. Our next meeting will be at 9 a.m. that day. We will start at 8:30 for the water board, okay? On that same day. All right? Thank you all. Yeah.
Hey, wait, go ahead.
Hey.
I was actually trying to come
Why
up
do
to
I
let
know
you,
you?
because I'm Dr. Frida Secretary.
That's why I was.
So I was coming because I was trying to let you know the motion for the consolidated board, that you have to do this together. You have to say that you want to consolidate the board, but you also have to say how you want it to be run interim while you're deciding.
Well, we did. The boards are gonna continue as they are.
But that wasn't in the motion. I was saying.
I have to go by what Ed said, told us to do.
Yes, well, and that's what I was trying to tell, get up here to make sure you knew. Because, so I don't know how y'all feel. And if you have to.
It ain't gonna affect anything anyway, so if we have to fix it, we can do it.
Well, no, the reason I'm saying that is because that's what, because I don't know know if he invited you to the meeting that they set up with the lady at the UNC School of Government that came to talk to the Board of Health about what happens and how that's supposed to go. Like, she literally went through like the like statutes and everything with us, trying to make sure that it would know how it was supposed to go. And
Supposedly he does,
and
but I don't
so
know.
so that's why I was trying to say, you gotta do both. Like, it has to be stated, because if you don't,